seated. You can do them
Hold this.
supine.
Do you find that there's an easier way?
Definitely supine. If you're just palpating, it doesn't matter. If you're actually trying to get in there,
Oh, yeah,
it's
supine.
really deep. You need to relax. So with Iliacus, you just find the anterior superior iliac spine, which is nice and prominent. And I'm not going to go very deep because I have very long fingernails. But you find their anterior superior iliac spine, and the muscle is right on the bone, so you're not pushing in towards the belly button. You're trying to hook around the iliac spine and get in there. So your pressure is kind of more like coming down into and it's deep. It's not very comfortable, and so you have to use breath. Like you wouldn't just start here. And I'm not going to go real deep, but your client breathes, and usually you just kind of settle, and then when they exhale, you can go a little bit deeper. But you can really, if you take your time at it, you can lose your fingers and get down in there. It's just important that you're not pushing this way, because you're trying to hook around it. You're trying to hook around it, and really all you're doing is trying to get in here and compress.
Would it be inappropriate, so if they were laying prone, could you hook under and just like have gravity kind of
That's a good question.
let their body fall? If you just
That would be a
I'm not
good
going to say
idea.
no. I don't know. Probably.
And to get it to
Fire.
fire, to get it to fire, you can move this.
So to know if you're on it or not, and one thing you can do is it's a rotator, right? So okay, so if you don't even have to lift your leg, just barely think about lifting your knee off the table, and I can feel it. No, okay, lift your knee a little bit more. Your foot off the table. Yeah. And it kind of fires in there. But it's very, very deep. And I'm not deep enough, which is why I'm not feeling it very much. But if anything, and I just left her really quick. I wasn't very deep, luckily, but when you're in, the deeper you're in, the slower you have to remove. Or you get like a rebound effect. It can be really tender and painful if you're in really deep and you just pull away. So you want to, I guess the rule is kind of come out almost as slowly as you went in. But so sorry about that. So you're just trying to, if anything, you're just trying to do you can either do little compressions, little moving compressions, or it's not a real big movement. And then once you get in there with one hand, since they are lateral rotators, once you get in there too, one of the things that might be easier to get in there is to start with the hip flexed a little bit. So like definitely bolster if you're trying to get psoas or iliacus, bolster a little bit, because that'll flex the hip to soften the muscle. You can get in deeper. And then once you're there, you could use rotations. So now instead of moving my hand, I can move the thigh, would give a little bit of movement. And then I can even
Are you trying to do the psoas now, or are you still on that?
I'm still trying to do iliacus. I'm not real deep, but so you could, once you got in deep there, still hand, you can rock the thigh, and then you could even have her slide her. Now you can have it lengthen it. She could slide her thigh down, and it feels firmer now. Like it definitely helps to get deeper if you start with the thigh flexed. Do some rocking, then she should extend. You could still do rocking down here. Come out slow. And then for psoas, you can have your person find their belly button for you. So psoas can be done through a sheet. And then you find the anterior superior iliac spine. And you connect the dots. And you kind of go in between. And it is true that you are kind of going towards the spine, but if you push in towards the spine too much, you can hit the vertebral body. So I wouldn't, you're not pushing this way. It is kind of straight down. And you start with, bolstered and make sure that they're kind of relaxed and stuff. And then you have to use breath. So I can't go in deep. Does anybody else want to go in deep? I can't with my fingernails over there.
I will.
Okay. So when she
If she wants me to.
exhales, you know, she looks like she's being a very cooperative client. So when she exhales, you can go a little bit deeper. You
Although
check
you've already
in.
done this yesterday. Do
Yeah,
you
we
really
did
want
this
it again?
yesterday.
Do it
Yeah, so you
again.
need to do it again. Maybe
okay.
maybe the other side. But to check to make sure that you're on it. If you are on the right muscle and you just have them just barely try to like lift a leg, you should feel it.
Yeah, we did yesterday.
Does that feel like where we were at yesterday, Hannah?
Yeah.
Did it feel the same? Because I feel like when Lori did it yesterday, it was more lateral.
I feel
Like
like
she was
more
more
than
Iliacus.
That's what I was thinking too.
So as where's your belly button again?
Right here.
Okay. So as goes from it goes from transverse process, and it doesn't go to the anterior superior iliac spine. It goes to the it goes into this femoral triangle. So here's ASIS. Can you palpate your pubic bone for me, please? Like your
How far do I need to go for this?
your
Right to your
pubic
bone.
bone where it gets hard, right there. Okay, so she's got her pubic bone. So here's the line where her inguinal ligament would be. Here's the top of the femoral triangle. So you want to be above that. So you could do, if she palpated, you know, one finger belly button, one finger pubic tubercle, you know, and then I'm on inguinal and ASIS. You've got this, you know,
So you got to go right.
kind of in, you're above.
No.
You were more lateral.
I think we were more on the Iliacus.
You were in here. Well, they come together down there. I mean, they do come together down there. But you can go in between ASIS and umbilicus. But you know, you want to assess, make sure you're not on a pulse, and then check your work. But if you're in the right spot and you go down, you know, you can lose your fingers. And having bolster hip flexion is going to help soften the muscles so you can get down there. And then if she lifts her knee a little bit, you should feel it. If you don't feel it, then you're not on it. So maybe try that with each other and see if you can find psoas. You can palpate it on yourself too. Sometimes it's easier. Like